Morning. Thank you all for having me here, and I'm going to be presenting on health equity curriculum for otolaryngology. So for some background information, the federal government has recognized health disparities as a national public health crisis. This is due in part to, unfortunately, the historical nature of subjugation that has occurred in certain population groups within our country. The National Institute on Minority Health and Health Disparities has made this a critical priority in terms of research funding and availability of options. In terms of Medline review, 94% of GME programs that do involve a health equity curriculum are permanently based in primary care. However, only about 6% of these options for a health equity program are seen in surgical subspecialties. In 2015, the American College of Surgeons developed a national surgical disparities research agenda. And given the importance and more developing talks on health equity and its importance within not only medicine, but within our subspecialty in otolaryngology, it is, from our perspective, seen as a critical importance to develop more consideration in how that applies into training. Thus, with the help of my co-residents, Robbie Patterson and Nicholas Crisco, under the guidance of Dr. Cannon, our advisor, we developed this curriculum with the long-term goals to develop didactic and experiential education that will not only equip trainees, but also departmental members to be able to identify and address health disparities within otolaryngology head and neck surgery. And in doing so, we were able to not only perform and conduct research, but effectively provide care for patients, particularly those in marginalized populations. So our innovation strategy, given that in surgical subspecialties, it's quite difficult to allot time for outside endeavors in addition to being able to complete rounds, perform surgeries, as well as take care of patients. We really wanted to work within the network of what our current curriculum and residency training provides. And in doing so, we looked at educational opportunities specifically through grand rounds, utilizing these weekly education opportunities to not only educate the trainees, but the department at large. So obtaining about 6 annual health equity presentations from speakers not only within the Duke community, but international experts who can come and speak to us about the foundations upon which health equity is built upon and how we can apply that within not only medicine, but our specific field of otolaryngology, as well as utilizing Journal Club. Ideally, we'd want to have biannual health equity journal clubs hosted by a trainee within the focus of the group. And then research. Throughout our residency program, we have a 4-month block of research during our PGY 3-year that allows time for a resident interested in whatever pursuant of research to fully delve into their research question. Thus, those who would like to delve even deeper aside from the educational opportunities of the health equity curriculum could work with a research mentor to further hone in on questions of inequities within otolaryngology. And in doing so, we first developed this by obtaining IRB approval in order to gain an assessment of what our current status of understanding of health equity is and how we'd be able to project that over time through recurrent surveys that will be distributed throughout our department. And these are just some of the priority topics that we'd focus on specific to our own education within the Durham community, how the underlying history of Durham has affected the presentation of patients with regards to particularly like head and neck cancer presentation and how there's been a disproportionate presentation in head and neck cancers within certain populations in our community. And these are just a few examples of some of the presentations we've had just this year where we've had like a partial rollout of the curriculum. We've had Dr. Michelle Morse, Chief Medical Officer and Deputy Commissioner for Health Equity from New York State come and talk to us, as well as Dr. Mark Schreim, one of the otolaryngologists from Mercy Ships Hospital. These are just a few, and we continue to have additional speakers scheduled to speak during our grand round presentations. So ultimately, our future directions, as was mentioned, we want to be able to have a long-term follow-up of the curriculum's efficacy through yearly faculty and trainee surveys. Ideally, we're going to start with the intern class coming in to see how the development of this curriculum over time has impacted their understanding and foundational assessment of health equity and how it impacts our subspecialty. And ideally, we want to be able to apply this curriculum across Duke surgical subspecialty departments to see the efficacy and how you can translate this curriculum to not only otolaryngology, but other surgical subspecialties that are in much need of an equity-focused curriculum. And then ultimately, we would like to submit this to MedEd portal for use to be applied throughout surgical departments throughout the nation at their choosing. And I just want to end this with a quote by Dr. Paula Farmer, who was one of the inspiring motivators behind this emphasis. And despite all the innovations that we are doing in medicine, we always want to make sure that ultimately the care is about the patients and providing equitable care to all patients, regardless of their background. And this is just our contact information. Thank you.
Thank you so much for your presentation. You are indeed working on a very important topic that's very timely. So I have a couple questions for you. I have a lot, but we'll get to all of them. So I'd love to ask you a little bit about your competition. So you talked about some of that training that's been very focused on primary care. What is out there in the field, and then what from that led you to the approach that you decided as far as what the elements were going to be of this curricular approach?
So from just a review of some residency program websites and what they do offer, the majority of the programs in terms of like primary care, internal medicine, even in family medicine, they specifically have like separate rotations that residents can participate in, whether it's doing field research, whether doing global health initiatives or working in different departments, or even doing health policy analyses. The difficulty in applying that into a surgical subspecialty is, of course, the training and the requirements that we have in terms of hitting our case numbers. And how do you condense that in an amount of time that you would still be able to get your surgical numbers as well as integrate that into the training? And I think specifically within our surgical subspecialty, what's nuance is how patients present in the manner, because a lot of what we do is intervention based in terms of whether you're going to the OR or you're doing endoscopic procedures within clinic. So we're just trying to figure out a way to best integrate that. And so just by having that foundational analysis of what is the understanding and how do these patients present in the manner of otolaryngology is really what the foundation question was.
And then I know it's early, but do you have ideas right now on what that revenue model is going to be when you can get this out into the world and who pays for it?
So for right now, we have created a budget, and we have really been working within the Duke network in terms of trying to acquire grants. And it's still an ongoing process, but within our own department, we've been working with Dr. Cannon, who is our vice chair of diversity, equity, and inclusion, to really flush out a budget and be able to understand how this would best be supported. Ideally, one of our hopes would be to obtain NIH grant funding through the National Institute of Minority Health to be able to help fund this, and to kind of just set the initial barriers up, decrease the barriers up for individuals who want to create a curriculum such as these. But ultimately, we'd want to also work within our own community of talking to the Society of University Otolaryngologists and presenting this curriculum, and hopefully even get funding through the academy to do so.
I love that. Really important to have. I love the non-dilutive grant approaches when you're trying to get something developed, but then figuring out, what's that sustainability plan and for the costs that are ongoing to keep this going for years and decades. Awesome. Thank you.
Thank you.